data profile. My name is Allison Abayasekara. I'm the Director of Training and Technical Assistance here at the Association of Clinicians for the Underserved. Today we're going to walk through how to use and understand your individual data profile, and we welcome any questions or concerns at any time at our number 1-844-ACU-HIRE. The Association of Clinicians for the Underserved was founded in 1996 by National Health Service Corps alumni. We exist today to help increase the number of clinicians in underserved areas and to support clinicians who are serving in underserved areas. In summer of 2014, ACU received funding from the Bureau of Primary Health Care to serve as a national cooperative agreement, helping community health centers increase and improve their recruitment and retention programs for their clinical workforce. To that end, ACU created the STAR Center, Solutions, Training, and Assistance for Recruitment and Retention. The STAR Center offers just that, resources, training, and TA for all health centers free of charge to help you improve your workforce programs. We have a lot of ideas, but unfortunately a limited pool of resources to draw from. So ACU needed to figure out a way to identify and in some way quantify workforce need. What is the specific workforce need in the country? Which health centers are struggling with which issues? And how can we be helpful to those health centers of highest need? We created individual recruitment and retention profiles for every health center grantee in the country. These profiles include about 65 different data points from 10 different data sets that cover a wide variety of issues that could affect recruitment and retention at each individual health center. The profiles are confidential, but they were distributed in May 2015 to each CEO. So each CEO received a copy of his or her own profile, but they are otherwise confidential, and you can be assured that your data is secure. Today we're going to walk through what that individual profile looks like and how it is that you can use it. Here's a glance at what one individual profile might look like. As you can see, it's a lot of information. It's a lot to take in. We think there are many important and exciting features on this profile, so we're going to walk through it for you section by section so you can take in what each piece is telling you. The top section of the profile is your descriptive attributes. That really serves to define what we mean when we say your health center and your service area. Data itself is exciting and is king in many ways, but unfortunately the data that we have is a little bit dated. All of these profiles were based on a Uniform Data System, UDS, data from 2013, and it's currently, at the time of this recording, August 2015. As you can imagine, a lot will have changed in that time. So these descriptive attributes serve to tell you what your health center and your service area look like at the time we took the snapshot that is this data profile. On the left, you can see health center organization information, number of sites, number of medical users, etc. And on the right, there's service area information. The middle section is a map, and again serves to show you descriptive and further definition. The dark blue area is your core service area, and we've defined core service area to mean where you get 75% of your patients at your health center. The little yellow dots you see on the map here indicate where you have your delivery sites. Most of the important information is in the bottom two sections of the data profile. As you can see on the left, we have broken things into recruitment and then health center and service area information. So for each data point, we have the data point. We'll look at these two today, language focus, and then that health center's individual number. This one's 22%. The next row is 4-year average profit and loss, and this health center's number is 4%. So as you can see, we have various data points and then the number we have for that individual health center. What we did is we stacked all of the data points for each data point. We'll look at this one, language focused, together. And we said, okay, what would be some outliers? If we look at all health centers nationally, what do they look like and what's the distribution curve? If any health center is on the fringe, sometimes if their number is too high, sometimes if their number is too low, they received a little blue flag that looks like this one here and this one here. Your number is highlighted in blue to indicate that you are some way an outlier for this data point. Now, having a blue flag is neither inherently good or bad. It's really just to say you look different from a lot of the other health centers, from most of the other health centers in the country in this way. And what does that mean for your recruitment and your retention? For example, this blue flag on percent of the service area with limited English proficiency, that's not a good or a bad thing. It's just descriptive. And knowing that you have some of the highest language needs in the country compared to all other health centers, how does that affect who you need to recruit, how it is that you can retain them, and how you can appropriately build your workforce around who you're serving? You'll also notice that some data points have a gray box. This simply means that we did not have data for that data point, and you can do your own investigations on why that would be true. Now, we've looked at the recruitment section. There's also a retention section. As you can see here, retention, the health center information is very big. We do also have some service area information. So a lot of the really actionable items and data points are in this retention health center bucket. You can see there's lots of different things like the patient panel per medical provider FTE, your primary care clinical support ratio, your trend for tenure for your physicians. Lots of those kinds of things that you can take a look at and say, what administrative or operational choices have we made that have made this friendly or less friendly for the clinicians that we have? But I also draw your attention to a couple of interesting data points that have more to do with clinical quality or the service area. So you may see things here like clinical quality for controlled diabetes. You'd say, well, this is a workforce profile. Why is this measure here? Well, for diabetes, for example, if you have a lot of uncontrolled patients with uncontrolled diabetes in your health center, that's a lot of what a clinician is going to see day in, day out, with not a lot of change. That can be really exhausting for a clinician and add to clinician burnout at your health center. So if you look at the numbers and say, wow, we have some of the highest uncontrolled diabetes nationally, what kind of environment does that create for our clinician, and how can we create an environment that, number one, increases the quality of patient care and engagement in that issue, and then also really supportive of that clinician? So can we hire a diabetic health educator? Can we create a community garden? Can we partner with a local business to offer Zumba classes once a week in our parking lot? So really, you want to look at how do all different kinds of aspects of your health center affect workforce. Now, all of this I know is a lot of information. I've said a lot of data points, and you might think, what does that mean? Where is this number from? How can I understand really what any of this is? And we have an answer, and to that I will say, learn to love your user guide. We developed a very detailed user guide that walks you through each individual data point, and it's available on the STAR Center website, chcworkforce.org. On the resources page, you can download a copy of the user guide yourself. And I've blown it up a little, so we're just looking at a few rows here. And I'll walk you through how to use that user guide Really, you want to look at the user guide in tandem with your data profile. So you can go through each data point and say, what is this data point and what does this number mean and why do I have a blue flag here? So for this exercise, we'll look through rows 2 and 3 of the user guide here. This is one we looked at earlier, language focus. And here's the other one, for your average profit and loss is % of expenses. So you can see each of these, we'll go to the source table. Language focus was taken from UDS, table 3B. This for your average profit and loss was taken from UDS as well, but from 4 different years of UDS and from 3 different tables. So this gives you the opportunity to go back and see what numbers you had there and how maybe you've changed. The next column is the descriptive column. When I say language focus, what I really mean is the portion of the total patients seen at your health center that are best served in a language other than English. So a lot of the descriptive information, especially for the more technical data points, we really want to check out this description column and see what this number is really measuring. For us, the most exciting and interesting part of this is the distribution we see at the end of those rows. Now you can see we have a centile distribution across all health centers. So this is the distribution curve right here that is for the language focused data point. So again, that's percentage of patients best served in a language other than English. Health centers went from 0% to over 53% of their patients. And this is what that curve looks like. You can see it's a slow creep and all of a sudden a big jump. And each of these curves looks a little bit different. So for this one, pretty wide distribution. And again, we needed to decide, okay, what's an outlier that may require specific action from that health center? And for this one, we decided to flag at the top end. So there's another column that says threshold, and you'll see here we flagged at the top end, greater than or equal to 53%. So for this data point, we saw where it came from, we saw what it means, we see the distribution, and if my number is 53% or higher on the data profile, then my number is going to be in blue to indicate that. Now the second row, if you'll remember, was looking at for your average profit and loss. And so in that case, health centers went from below negative 11% to over 16% in growth. We decided for this data point, here's the threshold column, we would flag at the low end. So you can see here that we flagged at the low end. So if you have a blue flag on your data sheet for this data point, that means you're down here. So we flag sometimes high, we flag sometimes low, we flag sometimes the tail end of each piece. Really, you want to go through the data profile yourself and see what do all these numbers mean, or this data point is really interesting and important to me. Where does my number fall? I may not have a blue flag, but how am I doing across all health centers nationally? Really, so what? We have all this data, we've given it to you, and you say, okay, I understand how to look at it and how to start to understand it, but so what? What should I do with it? And this is really what we encourage you to do, is look at your profile and look for those blue flags. Those are, again, the ways that you look really different from most other health centers. And say, okay, I'm looking at my user guide, I understand what this data point means, and I understand that I have a blue flag in it. The next thing you need to do is add context. Why is your number that way? You know, a lot of the data points are a little bit tricky. There's one data point that looks at the number of months you had locum, but it also captures the number of months that you had residents or non-full or part-time staff in a position. So let's say you have a blue flag on that number, and you have to say, why do I have a blue flag? Oh, that data point captures my residents. That's actually something really great that we're doing at our health center around workforce, and I don't see a problem here. I can move on. Or you may look at a data point like that and say, oh, We don't have a residency program or long-term contracted staff. Have I really used that many months of locum? Am I really that out of line in using locum so much with other health centers? Let me figure out how to solve that problem. And the solution is really where we hope to come in to help you. We have free technical assistance available by phone, by email. We also have a pot of money for on-site technical assistance. And that's all essentially paid for already by the Bureau of Primary Health Care through the NCA designation. And so we're here to help. We're here to help you go through your profile. We're here to help you ask some of the tough questions about why did this number turn out this way. And we're here to help talk through, so now I see that I have a blue flag. What does that mean? What's my actionable next step? Now we do provide other different kinds of data analysis, and that will be ongoing. We do currently have state aggregate reports that look at the percentage of blue flags in your state. Please be in touch if you would like a copy of one of those. And in general, the profiles, I said they were a snapshot of time, and they're just a snapshot right now. We intend to update these annually and redistribute them to you. We are counting on your feedback right now about what you like and what you don't like and what you need to have and what information would be useful to you so that we can update our template and put in updated data points and send you the new data profiles at the beginning of 2016. Your feedback is extremely important, and we look forward to hearing from you on that. Here's my contact information, direct contact information, as well as the contact information for the STAR Center generally. You can call or email us at any time. We would encourage you now to make sure that you have a copy of your health center's individual profile and go through it yourself, go through it with your team. Please call or email us. We'll go through it together. And hopefully ongoing, we can talk about how to continue making your workforce program successful.